Today, I will be discussing about uterine fibroids and uterine fibroids in pregnancy. By the end of this video, I will be able to inform you about the risk, complications, and treatments of uterine fibroids before pregnancy, during pregnancy, and after pregnancy. Uterine fibroids are non-cancerous growth of the uterus that often appears in childbearing years, also called as leiomyomas or myoma. This is not associated with any increase of uterine cancer and can almost never develop into one. Fibroids can range in sizes from seedlings that is undetectable to the naked eye to bulky masses that can actually distort your uterus. You can have a single fibroid or multiple ones. In extreme cases, multiple fibroids can expand the uterus so much that it can go up to the rib cage and can add weight. This information is from mayoclinic.com. So as we look at this picture right here, this is the types of fibroid, and I'm going to be discussing it to you. Intramural fibroid is one of them, and it's the most common one, and it grows inside the wall of the uterus. Submucosal fibroid grows inside the cavity of the uterus, and the subserosal fibroid grows outside the uterus. After discussing that, I will be discussing the symptoms of fibroid: pressure on bladder or rectum, frequent urination, constipation and or rectal pain, and lower back or abdominal pain. After explaining the types of fibroid and the symptoms of it, I'm going to discuss the complications and risk of it in pregnancy. Complications during pregnancy, one of them is pain. In pain, this is associated to the degeneration or torsion of the fibroid, that the blood vessel is constricted and it constricts the blood supply to the fibroid, and that happens when the baby grows bigger and it constricts the blood supply of the fibroid, and that can cause extreme pain to the mother. Second is miscarriage. If you're trying to get pregnant and the implantation cannot be successful if it had implanted in the fibroid. Preterm delivery or low birth weight is also another one. In this picture, there is a baby and then a fibroid inside, which is submucosal. So the baby is sharing the space with the fibroid, thus can cause preterm delivery. Cesarean delivery, cesarean section can be elective and emergency C-section. Breech position can also lead to cesarean delivery. Placental abruption is this placenta can be separated from the uterus if you have fibroids in there and they're big enough to constrict and to cause the placenta to separate from the uterus. Thus, it is very risky for the mother if that happens. Placenta previa is when the placenta is laying low and it's almost in the birth canal. That can also be the cause of a cesarean delivery. And distortion or fetal pressure in this picture, it shows that the fibroid is pressing against the baby's back, and so it can cause distortion or fetal pressure. Treatments. So after I have discussed the risk and complications of fibroid in pregnancy, there's also treatments. This is before, during, and after pregnancy. Before pregnancy, you can take medications that could lower your estrogen level and can shrink the fibroids. There are also minimally invasive procedures. One is the uterine artery embolization. They inject embolic agents that shrink the blood vessel that supplies blood to the fibroid, thus killing it. Radiofrequency ablation is removing fibroids through radiofrequency. Laparoscopic myomectomy is removing the fibroid through a surgical instrument with the camera from your abdomen, and you remove the small fibroids or cut the bigger ones, and then you can remove it. Hysteroscopic myomectomy is one that's also a procedure that removes the fibroid through the vaginal canal. So it is very important to know if you have fibroids or not, and if you have the symptoms of having fibroids it is very important for you to consult your doctor and have a specialist so that you can be taken care of properly, especially when you are pregnant. So this is the end of my speech, and I hope that you have learned from it. Thank you so much, and good evening.